Well, first of all, thank you for this opportunity. It's great to be able to talk with you and do a little bit of conversation about veterans in particular. It's always been very important to me. I mean, like most families in Eastern Washington, my father, grandfather, my husband, all Navy veterans, my brother, an Army veteran with deployments. And so I think it's a very personal issue to most of us that veterans, that both our armed forces services men and women get the support they need, and then once they leave service, they continue to get especially the health care and support they need. So this is something I worked on at the state level. I'm very proud that one of the first bills that I was able to pass in the Senate was in-state tuition for our armed services personnel, and it's that was an idea that came to me from Fairchild, and after we passed that, it went on to apply to the family members of our armed services. It's hard to believe that back when I was in the Senate, people could be stationed here and couldn't attend EWU without paying out-of-state tuition. Wow. So that was a big deal. And I was also able to work on an Eastern Washington veteran cemetery. And again, the idea was brought to me, no veteran cemetery east of the mountains, and we were able to get the cooperation going and the initial funding for that. And I'm very excited every time I drive past the Medical Lake exit and see that we've got that VA cemetery.
What would you like to do if you are successful in this campaign? What would be your first order of business as it pertains to veterans?
So what I have seen is really over a decade of declines in performance of the VA system and an increase in complaints. That's what I hear from veterans here. And sadly, that has happened under the watch of our current member of Congress. The emergency room service at our VA hospital here has closed. Clinics that we had in Colville and Republic, the first time I was in Republic, I heard we used to have a one-day clinic for veterans. It's gone. And so I would like to bring a focus on how we provide those services, especially to veterans in rural areas. It's not as much of an issue perhaps if you live in the city, but in Eastern Washington, where people can be hours away from a major hospital, it's a big deal to not have specific services for veterans.
And so how do you do that in a machine as large as the VA?
So I think that perhaps one of the problems we're facing is that bills pass and they sound good, like a few years ago when the Choice Act passed. Choices, that sounds good, who's against choice, right? But they're not funded, or they're not really resourced appropriately, so it's more coverage on paper than it is in reality. And so that is going to be a priority struggle, right? We have to figure out where are we putting our federal resources, and I think that the resources are there. We're an affluent country, we pay enough taxes, so the resources are there. We've just got to put the VA at the top.
Do you think that Representative McMorris Rodgers has done enough for veterans here in the 5th District?
I was pretty shocked about a year ago. This was before I was in the race, but you know, campaigns starting to gear up, and the Congresswoman said, look, we've got a leaky roof in the VA hospital here. And I have to ask the question after 14 years in Congress, why is that? And she has been quoted as saying it's not a funding problem. Well then, if it's a leadership problem, if it's an administrative issue, then after 14 years, why aren't we taking care of it? Same thing, we also have a VA hospital in Walla Walla, and it's had challenges and poor performance ratings. And once again, I have to say why. That is a #1 role for a member of Congress to advocate for the federal programs that are in your district.
So one of the things that you had discussed was this doctor shortage. The VA here in Spokane, and all of them actually, are faced with that problem. How would you try to solve that?
So first of all, I'm really excited the work that I was able to do with the team of community leaders and WSU leaders to get the new medical school off the ground with a focus on rural and underserved communities. Certainly veterans are an underserved community. And on top of the medical school, residencies are an important part of that, and we started a new residency program. And I think that the combination of those two can lead us in the road of having more healthcare providers. But let's face it, it's partly a pay problem. If you can't pay appropriately, it's hard to recruit doctors to serve in a VA hospital. And so we've got to be straightforward about the funding challenges there are and meet those challenges. The Congress just passed a bipartisan bill called the Mission Act. Again, it's got some very positive promises in it, but it hasn't been funded yet.
And so how do you fix that?
The budgeting problem of Congress, I'm not going to tell you that as one individual fixes that. However, I think that part of the answer is working in a bipartisan way across the aisle. And certainly in the legislature, when we passed construction budgets that funded things like the VA home here in Spokane or the one in Walla Walla, those were construction budgets that had Democrats and Republicans, House and Senate. And there just seems to be this approach right now that's more about blame or taking credit, and red versus blue, and liberal versus conservative, D versus R, and I think most people in America, and particularly in Eastern Washington, want to get past that. I mean, we just don't identify with that. If you're urban, you're against rural, or vice versa, because we appreciate that we have this amazing district with both. Then we get to take advantage of the advantages of both. And so I'd really like to see that happen in Congress. I have a track record working with people across the aisle to make things happen, especially in budgets.
What about the urgent care at Mann-Grandstaff? We have heard that obviously the ER had closed, that they were going to bring back this urgent care. We've been hearing a lot about it, but it hasn't happened yet.
Again, I think that's likely both a combination of administrative problems. We have a lack of leadership right now, both at the local and national level with the VA, and a funding issue as well. And so I understand it's challenging to come up with resources. You often have to identify something you are not willing to fund in order to fund a priority, but for me this would be a top priority.
What about the mental health crisis within the veteran community? What needs to be done to make sure that those who have left after deployment, who come home, to make sure that they are getting the treatments and services that they do need?
One of the things is we need a more seamless system. We worked on this again at the state level, where we passed mental health parity. The idea was that insurance shouldn't be broken up into what happens in your head and what happens below. And we need that kind of approach. It needs to be comprehensive as well. Many times these services are siloed. So say substance abuse is here, and mental health challenges like depression are here, and maybe post-traumatic stress is over here. And frankly, we don't, as individuals, we don't operate that way. Things are not siloed. And so we need that kind of comprehensive, I'd like to see on-demand treatment for substance abuse in all of the counties of Eastern Washington.
You did mention the rural communities. What else do they need? These clinics are obviously an important part, but what else?
Well, the basic underlying structure of healthcare is not being addressed right now. And I think I hear that everywhere I go in town hall meetings, from Newport to Clarkston to Walla Walla. Number one thing people come up with is to tell me sometimes very sad personal stories about prescription drug costs. And you have to ask the question, why isn't Congress taking that on? Again, there's a concern out there that vested interests set the agenda, and they prevent legislation coming forward that may interfere with the profits of pharmaceutical companies. The U.S. has enough bargaining power that a tough federal administration should go out there and say, we are going to bargain for reasonable costs for prescription drugs, so that we don't have to hear stories of my mother went back to work at Walmart to pay for prescription drug costs for her and my father, or people who are sadly not taking their prescriptions or cutting their pills in half because they can't afford them.
That is something that I have questioned the current representative many times about. How do you lower those prescription drug costs, not just for veterans, but for everyone?
So unfortunately, I think she's gone a little bit in the opposite direction. She's actually worked for specific provisions in budgets that would allow certain companies to continue to charge higher prices. That's the wrong direction. The other thing is the federal government could utilize its bargaining power to win these discounts. We did that at the state level with our Medicaid population, and that resulted in lower costs for those prescriptions, which frankly, since taxpayers end up paying some of those costs, was lower costs for taxpayers as well.
What do you hear from veterans when you're out campaigning as their top concerns? What are you hearing from them?
Access is really a problem if they live in rural areas. Red tape is a problem. The Choice Act was wildly unpopular in terms of the confusion that was caused, in terms of getting a referral to a private provider, but sometimes there was a lack of clarity in terms of what that covered. And so then the veteran finds out they've got a bill that they were not expecting. And private providers aren't that thrilled with the level of red tape either. And so those are the things that I hear that are most concerning.
Do you think that moving in the direction of having private providers, do you think that is part of the answer, or do you think it should be through just the VA?
So here's the thing. I believe that there are specialties and circumstances in which having access to alternative private care can really bolster and support the underlying system. But I want to make it clear, I don't agree with the bill that the Congresswoman drafted a couple of years ago and put out there that would essentially completely restructure the VA into a nonprofit corporation that only contracted with private providers. I think that is the wrong direction. We just don't have enough quality in the private system right now to say that that's the direction we're going to move the VA. In fact, it could be the other direction. If we invest and concentrate and focus on the VA, it could become the best practice that could lead to expansion to other types of care. If it was working for veterans, we could start to say that there are maybe family member services that could be provided that way in a cost-effective way on the large scale that we need.
Anything else that you think is important as it relates to veterans here? Because it is such a big part of this community.
I think it's just important to know that this is, we've got to go beyond, frankly, the surface issue and make the reality that the undermining of the system happened over a long period of time. Certainly, probably both political parties bear some responsibility for that, but rather than blame, it's time to come together and become advocates, and frankly, we have to put our money where our mouth is when it comes to our veterans.
What about Fairchild? You know, we were up for these new tankers and then we didn't get it. Is there anything that you think could be done to kind of improve the standing of the base to make sure that it's successful as well?
Well, I'm excited about the possibilities for, over time, new missions for Fairchild. I mean, we have the survival school. Now that we have a growing medical education and research campus with multiple institutions, UW, WSU, Gonzaga, et cetera, think about how we could play a larger role in disaster response and emergency response. That's going to continue to be a problem for our country and other countries, national disasters, unintended storms, and things that occur that require a different kind of response. I think we're very well situated to be a place that could both develop best practices and then train others with regard to those best practices. So a combination of our healthcare expertise with our base that we already have.